Welcome, gang. We're so happy that you're here tonight. To let you know, we have 248 people registered for the webinar, and you're coming on hot and heavy. So we should be fine. No, so that we will record this, and it will be available for you as early as tomorrow. So be watching for that in your inbox. We'll also follow it up with a puzzle piece. Stem cells are an incredible topic that is really hot out there now. Dr. Marc is going to give you the overview. What is a stem cell? What's not a stem cell? What's the best to use, because he's been doing this for a number of years and has trained under many different physicians. He is both an MD and ND and has a couple of PhDs under his belt. Just to let you know briefly who you're talking to, he's too mild to tell you this, but he literally graduated from high school at 7, from college at 9, and before his 13th birthday, if I have it correct, he graduated with an MD, ND, and a PhD or two. So he's a unique individual. He lectured for us at homecoming last year and will be lecturing for us at each homecoming. And he has a very specific outline tonight about stem cells and regenerative medicine. Just to let you know, 2 weeks from tonight, we're going to have one of his cohorts who sounds like him and laughs like him. He has a curriculum vitae that's 18 pages long. And we're going to take this stem cell discussion on from a PhD's point of view rather than a clinician's at that time. And in July 15 and 16, we're going to do our first stem cell seminar. It's going to be at Dr. Brett's office. So Dr. Harris will go over that a little bit, and we'll be doing explanation and also demonstration. And the people that want to have the injection or the push, etc., will be able to do that. You just have to let us know. So if you're interested in that, call Jason tomorrow. I think you all have that number. It's 480-964-5198. I'm going to turn the time over to Dr. Harris, and he's going to explain to you that he's been a Brimhall practitioner for a long time. He uses all 6 steps to wellness. He uses the OH nutrition, particularly the ones that I have developed, and he's researched out that they are effective and how they're effective. Dr. Harris, we'll turn it over to you.
Thank you very much, Dr. John. Okay, so thank you so much for being here this evening. Thank you for spending the time with me tonight. So what I'm going to attempt to do tonight is explain what stem cells are, the different kinds of stem cells, when they are best used, and I know many of our people attending tonight are doctors of chiropractic, and depending on the state you're in, you might not be within your scope of practice to inject, but what can we do about that? Is that an insurmountable problem? No, it is not. Okay, so let's get into that right away. So if you're a doctor of chiropractic, there are various states that have approached injections, notably Oklahoma, Utah, Alaska, Oregon, Idaho, New Mexico, and Colorado. But generally, the injections are about nutrient therapy, vitamins and minerals. So if you're doing a stem cell injection, can you consider that a nutrient? Well, perhaps you can, but maybe people who are interpreting that law might not interpret it the same way you do. So perhaps you're treading in an area you don't wish to tread. So there are different things we can do about this. So does it matter if you can't do an injection? Is there someone else that can do an injection? Well, yes, there is. If you're a medical doctor, a doctor of osteopathic, a nurse practitioner, a nurse, they can do this, and they can work in your office. You're the doctor, you tell what has to be done, and then someone whose scope of practice allows this can do this. But what about the cost of having them in your practice? That's someone you have to pay. That's salary, that's taxes, that's all the stuff that goes with it. Well, as we go further along, I think you will see that's going to become a moot point. Okay, so now there are 3 types of stem cells, and this is not perhaps the way you've thought about them, because when most people hear of stem cells, they think of embryonic stem cells, and they might have heard of adult stem cells. But let's go back a little bit further into embryology, which you got in medical school and you might have forgot about. Well, when an embryonic cell is very young, we'll talk about how young in just a moment, The cells are totipotent. They're going to become a whole person. They can also become a placenta, because without a placenta, we're not going to become a whole person. But then it can make every other cell. Then, just a few days after embryology begins, after that very first cell, cells become pluripotent. What that means is they can still become any cell in the body, but they can no longer become a placenta. Because once you've made a placenta, you don't need to make another placenta. So a pluripotent cell is what is often called an embryonic stem cell, and these tend to be more controversial as they are harvested at a very young age from a pregnant mother, but these have also been cloned, but they still came from a living being. And this is the one where people tend to have a lot of opinions and a lot of laws go back and forth. Now, when we get to an adult stem cell stage, that can be around 17 years of age when all our stem cells become adult cells. Then those are going to be able to become a few different cell lines, but not as many cell lines as a pluripotent cell. Okay, so looking at this pictorially, we have the fertilized egg, then it's going to go 2 to 4 to 8 cells. These are all identical. At this point, they're totipotent. They're going to make a placenta. They're going to make 10 toes, 1 heart, 2 kidneys, a couple of lungs, eyes, nose, nasal canals. They're going to make everything. They're going to make a person. As they get a little farther into this stage now, the blastula stage, now, mostly from all these inner cells, they are now pluripotent. At this point, now we're about 5 days in to implantation, to fertilization, about 5 days in, and now these are pluripotent. Then you have your first infolding, called the early gastrate and gastrulation, going to become the digestive canal, one of 2 tubes that will be formed. And now from this point on, we're going from pluripotent to a mixture of pluripotent and multipotent cells. So now let's have a look at the way this has been thought of from a harvesting technique. Okay, so we have 3 germ layers that form from the embryonic cells. Endoderm is linings of it's the mucosal layers, liver, thyroid, thymus, parathyroids, tympanic cavity, antrum, auditory tube, a lot of the hearing apparatus. Mesoderm, not listed here, but fat tissue comes from here, connective tissue, bone tissue, striated and smooth muscles, heart walls, but not the whole heart, blood and lymph vessels, kidneys, gonads, genital ducts, and part of the adrenal glands. And then ectoderm, mostly nervous system, skin, and some other tissues that we think of as outer tissues. So the thinking is, if you use mesodermal tissue to derive a stem cell, you can make mesodermal structures. If you use endodermal tissue to get a stem cell, you can make endodermal tissues, because if these are multipotent, they're only capable of producing some cells. This would make inherent sense. And this is often how it's taught. That if you want to do something for the central nervous system, for the brain, or for the spinal cord, you'd have to draw stem cells from a brain and a spinal cord. And that might be beyond most people's scope of practice. Well, perhaps we don't have to do that. Now, I'm going to give a couple of examples just from my own practice, because I've been doing this now for 5 to 6 years. And I started, when I learned this, I was taught to harvest cells from the body, process them to stem cells, and then put them back in the body. So, had a fellow with a shoulder problem, pretty much a wrecked shoulder. This was a football injury that happened 40 years earlier, 66-year-old guy. So, for him, because it's shoulder, I did a bone marrow extraction. And then processed the cells and injected them to his shoulder. And I wanted to follow. Now, typically joints respond very well to this, and often it's one possibly 2 injections. So we did the 1 injection. I asked him to come back in 3 months because that's about how long stem cells will continue to work in the body. He came in 3 months and said, oh, shoulder feels great, and by the way, my colitis is all better. I said, I didn't know you had colitis. He says, oh yeah, had that for 50 years. I said, oh, okay. And he was pleased. Okay. And I just put the stuff in his shoulder. That wasn't even intravenous. Okay, a knee injection. 84-year-old guy. Wrecked knee, no cartilage, meniscus pretty well chewed up, collateral ligaments, ACL, no good. And for this one, again, bone marrow. Now, the bone marrow, patients aren't terribly pleased when you take bone marrow out of their hip. And afterwards, they're in pretty bad pain for a couple of weeks. But again, brought him back at 3 months. Knee was all better, and he told me his type 1 diabetes was all better. I said, I didn't know you had type 1 diabetes. He said, oh yeah, I've had that since I was a kid. I said, perhaps you could have mentioned that to me, but I'm happy it's better. Okay, so now intravenous injections. We tend to think of intravenous for things of central nervous system, of autoimmune, of things that don't get better, really with other things you can do. This might be an Alzheimer's disease. This might be Lou Gehrig's. This could be Parkinson's. This could be sarcoidosis. Just the things that don't respond that well to other traditional therapies. And what are the possibilities here? This possibilities might be the universe. Dr. John sent out a puzzle piece that I hope everyone read. And it said, is this a magic bullet? And if anything is a magic bullet, this is it. Okay, so let's look at mesodermal tissue a little bit more. And again, we see the same list we saw before, but when you put a stem cell in the body, it can renew an area under direction from the DNA, or it can differentiate into repair, renewal, or new cells. So let's say you have necrotic heart cells. It can make new heart cells and make heart cells that weren't there before. But this is more in a pure totipotent pulse, so more what we call the embryonic cells. And differentiation, where we get into a little bit of not only patient discrepancy, but perhaps legal trouble, this has been shown that it has potential to cause cancer. And a lot of the cancers it causes are the teratomas, which are those we saw in books in medical school, where you might see teeth and hair growing in an abdomen. Probably in the realm of science fiction, but frankly it isn't science fiction. But it's not the only cancer cell it can form. But once you have a pluripotent cell with multipotent cells, then you're only going to do renewal. So it can fix anything, but it can't grow new things. Okay, so what's happened in stem cells? Stem cells were discovered at the Ontario Cancer Center by Tilla McCulloch. So it was kind of a happenstance sort of thing. They weren't looking for stem cells, but they did find them, and that was published in 1961. And then we have a bit of a legal struggle, not over the use of stem cells, but out of the research funding of stem cells. So in 1974, Congress bans federal funding of any fetal tissue research. And they hadn't cloned cells from a blastula yet, but it still brings up an ethical issue. Then 1975, an ethical advisory board was established, and then in 1980, President Reagan defunded it. And then 1988, a federal panel approved funding of embryo research. Then 1990, President H.W. Bush banned federal funding. 93, President Clinton lifted the ban. 94, he reestablished it. Why did he do that after he lifted it? This was public pressure. The kind of common chant of, you're killing babies. Okay, in 1995 comes the Dickey-Wicker Amendment to ban federal research. And in 1998, James Thompson isolates embryonic stem cells. These are from the very early tissue we saw just a couple slides ago. Then 1990, Congress decides that that doesn't apply. New effects go in 1999, 2000, and then in 2001, second President Bush prohibited it. 2009, President Obama reverses it. 2017, the Trump administration hasn't said anything about it yet. But what we can draw from this is the research into into stem cells, into the funding for the research goes up and down. Now, this is not the legality of doing stem cells. This is the research. Okay, but from a medical perspective, a couple things came up. 2012, they got stem cells out of urine. Well, that's not too tough to get out of people. You don't need even a license to do that. You can do that if you're a little kid, but you can't get that many. Okay, 2013, derived human embryos from cloned embryonic cells. This is just 4 years ago. So now we kind of don't think of the killing babies problem, but you still had to use those cells to make the cloned cells, and these are still embryonic cells capable of producing teratomas and other cancers. Okay, 2013, probably the watershed moment in stem cell research. A hamburger was made from stem cells. And then later, hearts, kidneys, brain cells, pituitary glands, it's been shown to help in blindness, in MS, and in 2011, the Pope hails the potential of adult stem cell research. So adult stem cells. So this is really at a stage from 7 months of embryology to approximately 10 years of age. You've got adult stem cells that still have some pluripotent potential, so they can become anything else. And that is why when you inject a shoulder, you can cure colitis. Okay, so we made liver cells, and those originally didn't have onions on them. There's the burger, probably not that burger, just the best burger picture I could find. I think it looks pretty good. And then that's a pituitary gland. Might have some other, perhaps depending on one's imagination, could look like something else. Been used for kidneys, been used to make hearts. And this is all pretty much laboratory use, but then you see, let me give you another patient case. This was a 22-year-old woman who had autoimmune destruction of her kidneys. She got a kidney transplant, was good for about a year, then her immune system destroyed those. So this is a case where you have to look first at her immune system. Why was it doing this? Because if we can regrow those kidneys and the immune system is going to attack them again, have we really done a lot of help? So this is where everything else we do becomes important. We have to do the 6 steps to wellness. We have to do structure on our patients. We have to work on their subconscious and unneeded and unwanted emotions. We have to look at their allergies. Are their adrenal glands working? If they're in your office, they're probably not working. So we have to work on their adrenal glands. If they're over 20, they might have a thyroid problem. Do they have heavy metals? Do they have chemicals? And yes, you can correct a lot of this stuff with stem cells, but at what cost to your patients? If they're there to regrow your kidneys and we have to regenerate every other part of their body first, then that's going to be maybe 15 stem cell treatments, where if it was just for the kidneys, it might have been 4 treatments. Okay, so is this a magic bullet? Now, not the greatest picture, but Alzheimer's disease is the buildup of tau proteins to form amyloid plaques in the picture to your left, and we form neurofibrillary tangles. And what I found in my patients, within about 4 injections, you don't see those anymore, and these people are fully functioning. and typically what caused Alzheimer's in the first place. They're starting to call Alzheimer's type 3 diabetes, so a blood sugar thing. So again, you got to look at what people eat. You have to look at their blood sugar metabolism and all the things in the 6 steps that would help that before doing stem cells to cure their Alzheimer's disease. Okay, so how do you triage something like a knee? This is a drawing of a knee, or the best x-ray ever, but you got your cartilage, you got your cruciate ligaments, lateral medial meniscus, you got ligaments. Okay, so how bad is this knee? So if you've got some cartilage, if you've got a little bit of a screwed up meniscus, maybe stem cells is not what you need. Maybe a lesser technique would do this, a less expensive technique. And that's one of the techniques I'll be teaching coming up in mid-July, which I'm calling stem cells and other injection therapies. So depending on a couple of things, now let's look at a knee that isn't so good. A little blurry, but you can see that on the lateral side of this knee, you don't have any cartilage left in there. And you got a pretty big gap, probably more than you should have, on the medial side, pardon me, on the lateral side. So now this is a knee. Would this respond to another injection technique? Probably. Might take 8 or 10 of them over the course of 3 or 4 months. So the question is, how much pain is this person in? How fast do they want to get better? And that's going to determine what technique we're going to use. It depends on the patient. It depends on how bad they are and how quickly they want to get better. Now let's talk about structure a little bit. Let's say we got this group of people. They're pretty young, probably teenagers. She's going to have an ankle problem. She's going to lose the curve in her back. That elbow is going to be a problem. That wrist is going to be a problem. Look at her neck. Going to have a torticollis over there. So is this guy. Again, an ankle problem. Now him, lower back's going to be a problem. She's going to have a neck problem, a shoulder problem. He's going to have knee problems, ankle problems, neck problems, back problems. Yeah, we can put stem cells into these people. They're pretty young. Their stem cells are somewhat viable, but we'll talk about that in just a minute. But unless we do structural correction, unless we adjust these people, work on their muscles and their fascia, then they're not going to get the full benefit of the stem cell therapy. So we have to do all the other pieces: structural alignment, advice, proper nutrition, adrenal, heavy metals, chemicals, emotions, infection. In other words, the 6 steps to wellness. And then we can do most of what patients need without charging them much more than they need to pay. But the stem cells are not inexpensive, but they'll get the most bang for their buck. Okay, so if we have an acute injury, you're going to have a more problematic person. This guy's about to have a life-changing event. And he may need some surgery. He may not. And if you do stem cell therapy for a joint, this can be a hip, a knee, a shoulder, a TMJ, really anything, you can probably avoid surgery 99% of the times. Now, if you crush this guy, if he's still alive, you might have to get bone fragments out of his heart. Stem cells probably aren't going to help that very much. That's one way to get hurt. Another way is an insidious injury. Comes on slowly, the proverbial straw that breaks the camel's back. Well, this is the person that's going to need to come to your office 3 times a week for the next 20 years, or get maybe 1 to 3 stem cell injections. And they're going to be out of pain, and they're going to be functional, and they're going to be functional in society, and they're going to make a living and pay taxes and be good for everybody. So we don't, again, depends on the severity of the injury, how we triage it, and how quickly people wish to get better. Again, what else is necessary? Let's look at this guy. He's got maybe some ribs out of place, Maybe it's his heart. Maybe it's his lungs. Maybe it's his gut. So we want to get those things fixed first because he might have Alzheimer's too. So we can put stem cells in for Alzheimer's, but if we don't fix his heart and his gut first, those stem cells are going to go to his heart and his gut. Again, 6 steps to wellness. Now this guy, probably just some structural stuff. Otherwise, not so bad. Might have a little hyperthyroidism. Look at those eyes, they're bugging out. We might have to look at that. Maybe some Graves' disease. Might have to look at his immune system. So again, 6 steps to wellness. Okay, so which cells do you use? We have a concept versus an autograft versus an allograft. Autograft is a cell you get from inside somebody's body. Okay, so where can you get these? Well, they've come from urine. You can get them from blood, you can get them from bone marrow, you can get them from adipose tissue. So urine, unless you're producing a huge amount, you're not going to get enough stem cells there. And do you have the lab facilities to process a few gallons of urine? If you do it a little bit at a time, it's going to take you 8 or 10 hours. It's not economically feasible. Blood, you get about 10,000 stem cells out of that. It takes about 3 hours. Not really enough to do anything. Bone marrow, you can get quite a few stem cells out. Adipose tissue, even more. So that's what's usually being taught now is adipose tissue. But there's something you have to think about here. How many cells are you getting? How viable are those cells? How does it feel for the patient to have that done? How long does it take the doctor? And how well can those cells reproduce once they're put in the body? Now, if you are doing a bone marrow extract, this particular apparatus, this trocar, you put it, this is the crest of the hip, posterior, and this needle gets, you do an anesthetic first. Anesthetic will largely take away pain, but it doesn't take away pressure. And this thing is hammered into the hip with a little bitty hammer. All right, now let's look at a newborn. 1 in 10,000 are stem cells, and they can reproduce a couple million times. By the time we're about 17, 1 in 100,000 cells are stem cells. They can reproduce from 1 million down to about 200,000 at this point. By age 30, 1 in 250,000 cells are stem cells, and they can reproduce maybe 500 times. By age 50, and this is when most people are going to start to think about a need for this. People are breaking down a little bit more here, and they got more chronic stuff. Now we're talking 1 in 400,000 cells can reproduce maybe 200 times. By the time we're age 80, it's only 1 in 2 million cells, and they can produce maybe 4 times. So you're not doing a whole lot of stem cell therapy on newborns. Most of them are healthy, not all of them. Teenagers, they don't really need it. 30-year-olds, if they've had maybe a football injury, they may need it. But now, you've got not much reproduction and not many stem cells. So you're going to harvest this stuff and you're not going to make a whole lot from it. So it's said that fat tissue makes the most stem cells. Let's look at that. Now, they put a pretty fancy word on liposuction stem cells, stromovascular cells, SVC. That's what they called it when I did it. And they charged a whole lot for me to take this course. And I figure they had to come up with a good name. So this is a pretty clean look at liposuction, but it's not like that at all. So this instrument is about 12 to 18 inches long, and it's open on the end, right in there. And right here looks like you go in there and you kind of suck out the fat tissue. That's not how it works. You've probably seen on TV, you move this thing back and forth at a pretty aggressive pace. That's how you do it. You're going to get a lot of blood in there also. So you anesthetize the patient first with lidocaine and sodium bicarbonate in a mixture. You squirt it all throughout the tissue, then you go in and you do this. You get about 100 cc's out. Takes a while. Then you send it off to your in-house lab, because this is an autograft. It's okay to do an autograft if you process it under the same roof and put it back into the patient within a 24-hour period. That's the law on an autograft. So you don't have to do the lab processing, but it takes about an hour, and someone has to do it, so you got to have an employee doing that. Okay, so how long does it take? Okay, let's say you're doing bone marrow transplant, bone marrow removal of stem cells. Takes about 15 minutes to prep the room and prep the patient. Doctor doesn't have to do that. The actual extraction technique, sterile technique, takes about 45 minutes. That's doctor time. Then it goes off to your in-house lab, which you had to set up. That's going to cost you $10,000 to $20,000. And then you go back into the patient, 5 to 15 minutes of administration, depending on what they need, either intravenous or joint, and then explanation. Okay, so that's really an hour of doctor time, and the patient is in the clinic for 2.5 hours. Okay, let's say you're going to do fat tissue. Pretty much the same thing. 15 minutes to prep, sterile tissue, sterile technique, betadine, you got to do a little surgical insert, 45-minute collection time, hour processing, same thing, 5 to 15-minute administration. Doctor time an hour, a little bit more, including explanation. Okay, so with that amount of time that a doctor is spending, you can do 3 to 4, maybe 6 patients per day. All well and good. Okay, now, a allograft comes from outside the cell, and typically this is going to come from umbilical cord tissue. Now, umbilical cord tissue is both pluripotent and multipotent. It can repair anything in the body, but it cannot become a stem cell. So the prep is 10 to 15 minutes. That's usually cleaning the patient off. That is mixing up the fluids, and we'll go over all that at the seminar in a couple of weeks. That all can be done by an assistant. You mix it up in the syringe. The doctor comes in and squeezes the syringe. And you can do it this one 2 to 4 patients per hour instead of per day. So can you afford to pay someone who is licensed to put a needle in somebody? Yeah, I think you can. So what is this good for? Well, quite a few things, and this is a far from exhaustive list. Chronic obstructive pulmonary disorder, congestive heart failure, cardiomyopathy, myocardial infarction, 30 years later, any joint, pretty much any neuropathy, neural degeneration disease, Alzheimer's, Parkinson's, spinal cords, epilepsy, cerebral palsy, pulmonary infarction, stroke, aging, cancer. Is aging a disease? Well, some people think so. And stem cells are the fountain of youth, and autoimmune diseases. Now, are there other ways to get to some of these? Yes. Are there some things that there's no other way to get through on this list? Absolutely. But we now have a tool. We have stem cells. Okay, let's look at an actual x-ray. Now, on the left is a modestly decrepit joint. And this is this was not actually a stem cell technique. This is one of the others I'm going to teach. But this was after 8 injections, and we basically have a fully functional joint. So how long does this take? In a stem cell, it's going to work in the body depending on the cells you use. And we like the autograft cells from the umbilical cord bloods because they're very potent and they can reproduce a couple million times. And the doctor time is minimized, so they work for 3 months. If you got an acute injury, that person who had the piano fall on them, you're going to do those maybe once a month for 3 months. If you got a chronic illness, like in Alzheimer's, like in Parkinson's, you might do these one every 2 to 3 months over the course of 4 treatments. You got someone who wants to do anti-aging, it otherwise feels fantastic. There's certainly a patient population like that. You can do it every 3 months, and they will live to be 150 and have no friends because all their friends will be dead. Okay, so again, it depends on the nature of the injury and what the patient wants. I had a phone call today. A patient's coming in the middle of July. He says, can we do stem cells that day? This is a fella who, perfectly functional, but they found a tumor in his neck. So they cut it out. After that, the guy couldn't walk. So after the first stem cell session I did on him, he was walking, albeit not effectively, but under his own power. After the second set, walking with just a mild limp, still a bit of trouble with stairs, but walking. Now he wants a third one. He's coming in mid-July for that. Okay, so we said that if you do 2 to 4 of these per hour, you can afford to hire a medical doctor or 2. So what does that look like? Okay, now typical American clinics were originally charging about $10,000. As more and more people started doing this, they reduced the prices to $7,000 or $8,000. And in the US, it's actually cheaper than even Mexico. Mexico's charging 10 to 20 grand. Europe, you're charging 20 to 100 grand. And in these clinics, it's mostly Americans. They're going over there to get this done because we've kind of stymied funding for stem cell research, other countries have not. So they've continued to do research. So they've been doing this longer than we have. The second stem cell seminar I went to was people from Cuba. This is when Cuba was much more likely to come to the US under the Obama administration than under the current administration. But the fact is they came to the US and taught it. They've been doing it for 30 years and doing research for 30 years. So we know a lot about this, but they still teach fat extraction and bone marrow extraction. So with what we're doing now, which is using stem cells that come from umbilical cords that otherwise are from C-section babies. So if we don't use these for stem cells, they're going into the scrap heap. But we have a little bit of legality in, do we call them stem cells? Do we know they're stem cells? Well, we probably do, but we might have to tread a little lightly. So when we get to the seminar, we're going to talk for a small part of it as what terminology do we use? What are the legal ramifications? What do we have to do? How do we present this to our patients and in our clinics so we stay above board? So this is a therapy that can work where nothing else can. This is a therapy that can change a patient's life and a family's life. And this is a therapy that is good for a doctor's bottom line. So stem cells, I believe, truly are the future. And if you can get on the stem cell wagon, you too will be part of this future. Okay, that's pretty much what I wish to say this evening. If there are any questions, please ask me now and I'll be happy to answer them.
Dr. Marc, while they're thinking of their questions, let me just relate my experience. Dr. Marc came down here a couple of months ago and he was going to treat some patients actually in the Arizona area. And I asked him, I was so interested in the stem cell, would he do an injection in me down there? So the way we do it now, most of the laboratories out there charge $2,000 a vial. Because of the company that Dr. Marc works with has introduced me to them, we have a special rate where the doctor's cost is about $1,000 a vial. And the least expensive I have heard any of the doctors doing an injection or an IV of those 2 cc vials is $2,500. So that means you have a $1,500 profitability, except for the few other expenses you might have, like needles and for a person to do it. Even if you paid them $100 an hour, you would still be making $1,200 to $1,300. A lot of doctors are charging up to $4,000 per injection or IV of 2 cc's. One of the clinics that I worked with is doing $2,500 per cc, but if they say they do your knee and your back and do an IV, that'd be 2 times 2 cc's, or they charge $5,000. I had Dr. Marc inject me in my median meniscus. I blew out 20 years ago. I had him injected in my 3rd lumbar. I had a rollover accident. I fractured my back. They said I have to have surgery. I'd be in chronic pain. I have no pain. Never had to have surgery. constant pressure down there. He injected me 2 months ago. It's 100% gone. My medial meniscus now, after 20 years, is stabilizing. I also had him do a 2 cc push. So again, in any clinic out there that I've seen, the minimum that fee would have been to me was $5,000. Thank goodness, we're friends, didn't cost me that much. But that's what it would have cost. Now, I wanted to go to the next level, so there's another doctor that will be attending our seminar. Dr. Marc is preaching January 15, 16 in Dr. Brett's office in Arizona there at the airport, and her name is Dr. Marc. So I went and saw her because I get to see Dr. Marc, and she wanted to show me how she could do the face. So literally, she injected PRP, and Dr. Harris will explain that when we get together. But PRP is another way of regenerating your own tissues by using your own blood, spinning it down, and putting it back into you. In this case, mixing it with the stem cell material. So I am experiencing that as well. It's amazing what you can do. And right now, although you know me, I'm a very high energetic person, but it's ridiculous now the way I feel, the way the joints are healing, and I'm 70 years old. Dr. Marc will go over this in great detail, and I asked him, and maybe he can elaborate on this, I said, have you had any quote-unquote failures since you've gone into using the embryonic tissue from the stem cells, using the umbilical cord from C-sections? He said, no, he's had no failures. In other words, he's seen improvement in every patient that he's treated, sometimes 1 injection, times up to 4. And Dr. Marc has it taken more than that on some cases. Have you had to go past 4 treatments?
Well, typically, even for something like an Alzheimer's, you don't really have to go too much past 4. But then you get the people who just want, these are your typical kind of people who are going to be doing human growth hormone injections every day and spending 10 grand a month on that. And they come across stem cells, they want that instead. But let me approach one more thing that you just mentioned, Dr. John. Yeah, the stem cells cost $1,000 for a 2 cc vial. Most joints only take 1 cc. You can do 2 joints, and you can charge $5,000 to $7,000 for that. Now, if you're doing adipose tissue or bone marrow, the collection kits for those about $1,000, and then takes 5 times as long. Your costs are not any lower doing those therapies, so you get less effective, costs you the same, and takes 5 times as long. So on every level, these umbilical cord cells are the way to go.
If I've ever seen anything in all my studies, and Dr. Marc fortunately has a better than a photographic memory. We've always kept mine's pornographic, but I have to read, study, underline, research, and Dr. Marc has been kind enough to research the products after I make them. Like he had documented, if you were able to come to homecoming, of the mitochondria product that I made that absolutely worked. It didn't matter the age, the sex, or the problem. Everybody he did, the optimitochondrial got better. Same with the adrenal, same with the thyroid, same the way we do the iodine, mixing it with selenium and molybdenum. I have spent a lifetime knowing how to mix products. He has spent a lifetime of trying those products along with his knowledge of other things that he uses, and we're seeing incredible changes. Right now, when we evaluate a patient, we do the 6 steps. We put them on the adrenal, thyroid, iodine, whatever it is they need, mitochondria product, and then to go to the next level. I'm 70. I don't want to act like a 70-year-old. Those of you know me know I don't act like a 70-year-old to start with because I've done the 6 steps for many years. But now, adding the umbilical cord injections, IV, and both into the joints and the areas that I've destroyed before, it's like I'm regenerating and more mobility. I'm sure my oldest son's an orthopedic surgeon. He replaces knees and hips and shoulders all day long. I said, well, son, how many people that I went to school with, because he's in that same area, have you done knees, shoulders, or joints? He said, 50 of them. There was only 80 in our class. But I don't have any of those problems because I do the 6 steps and add this stem cell to it. So for me, this is like a whole new rejuvenation, able to take it to a new level. And Dr. Marc, why don't you explain, somebody that complains about a $50 or $60 visit comes up with $4,000 or $5,000 if they think this will help. Has that not been your experience?
Okay, so basically when people are needing stem cells, they're pretty bad at this point. So this was a 74-year-old woman who cleans houses for a living, and she was going to have surgery on her hip. I said, I could probably fix that with stem cells. It's $4,000. She complained about a $20 supplement, and she plugged down $4,000 without a hiccup. So when people can get relief from something they thought they could never get relief for, they are going to find a way to plunk down that money, no questions asked. I've not had a single patient who's hemmed or hawed in the least about plunking down 4 or 5 large.
The interesting part to me is that where we thought there was no hope before, the only thing you could do was surgery, that it just isn't the case. Let's say knees, Dr. Marc, shoulders or hips. What percentage of the patients do you think you can help with this type of therapy that may never have to go to surgery?
Knee, shoulder, hip, ankle, temporomandibular joint, neck, back, SI joint. I'd say unless it's what I call that piano type injury where there's much more going on than a degenerative joint, we can fix all of the degenerative joints, all of them. And also the inflamed joints, the rheumatoid joints, we can fix those too. But that has to be through the 6 steps, then the joints can rebuild. But if it's the piano type injury, they're gonna need surgery. Anything else, we can fix.
Well, that's incredible because we've never been able to say that before because there was so many limitations of matter, how old people were, how bad their diet was. It just gives us a whole new avenue of treatment. Now, from what I'm seeing, and I've really been into this the last year, Marc held out on me that he was doing this for the last 4 or 5 years. I only found out a year ago he was doing it because I heard of a miracle case that the person had diabetes insipidus and then didn't have it anymore. And we know that just can't be helped. You can't reverse it, except doesn't exist anymore. It never did in Dr. Marc's vocabulary, because when you regenerate the tissues, naturally, they have the ability to overcome. We don't do it. They overcome the area there. I have seen nurse practitioners working very well with chiropractors. I've seen MDs, DOs. I don't know about a dentist. Can a dentist do this type of care, Dr. Marc, in some states?
Well, dentists can do injections from the neck, from the head up. They're not licensed to do them anywhere else in the body. So no, they wouldn't be able to do this anywhere except for a TMJ area. They couldn't do a shoulder.
Yeah, that's what I thought. So I just wanted to make sure there. But as far as an MD, DO, nurse practitioner, a PA in most states has to be under the supervision of a medical doctor, I believe. But nurse practitioners in Arizona and Colorado, they can work under a DC's license without any problem at all and do this from what I've seen. What's been now you as a naturopath and Bastures, where you graduate from those other areas. Now, how many states are actually licensed like you are as a real naturopath, not just a...
Well, there's about 17 states, but not all the states have the same scope of practice. Some allow injections, some do not. So it's going to depend on the state where you're practicing.
I know Arizona certainly does.
Arizona, pretty much a naturopath has pretty much legal right as a medical doctor. Arizona is the broadest in the country.
Yeah, and there's
but even that, recently there have been threats to it, but it didn't manifest.
Say that again, please.
Even recently in Arizona, there were threats to the naturopathic licensing laws, but it didn't manifest. And that was as little as 2-3 months ago.
Of course.
So, there's always when we're not medical doctors, there's always going to be a legal hurdle thrown up somewhere.
Sure.
So we're going to do this right, and we're going to kind of tread lightly, but do it correctly and protect ourselves at the same time.
Dr. Marc, I butted in there. Are there questions that people have written to you?
No questions have come up thus far.
Well, just to go on and say that we wanted to keep this within an hour. We still have about 11 minutes, so if anybody has a question, if you'll write them down, Dr. Marc can see them there and he'll answer them. But we do have a seminar the 15th and 16th of July, as I mentioned on the onset, in the Arizona area, and that is almost full. So if you want to get into that, you need to call Jason tomorrow and get scheduled. That's $1,000 a doctor, which is very, very inexpensive. Most of these seminars are from $2,100 to $2,500 for a 3-day seminar, and so we're keeping it less expensive. We want all of our doctors to be exposed to this and to learn it and to enjoy it. But just imagine. Now, on average, Dr. Marc, you're booked how much in advance?
I can go 3 to 6 months out.
3 to 6 months out, and you could do how many of these in an hour? You yourself, knees, shoulders, hips, spine.
Okay, if I'm prepping everything, I can do 2 an hour with no help at all.
And your minimum fee for that would be?
If I'm doing 2, depending on if I'm doing intravenous or I'm doing a couple of joints, that starts at $4,000.
So you can see it's very cost effective, and you're able to help people to a whole new level. Now, there's something else Dr. Marc and I are working on. As I said, he has an incredible memory, and he's read the genetic code, which I think you told me is 1,100 pages?
That's 11,000 pages.
11,000 pages. Well,
Yes.
I was giving slack. And he has to remember that information. We are working now to make very specific OHS nutrition to help alter that genetic code for epigenetic expression into normalcy, and also be able to monitor that with the stem cell and other genetic testing. So this next year is going to be so exciting. You're not going to want to miss homecoming for sure. Right now we're looking for funding so we can carry this to the level we want to do that too. What else do you think they should know, Dr. Harrison?
Well, as you mentioned this, the cost of the seminar, when I first was taking these seminars, and yes, they were teaching me the liposuction, the bone marrow, but those were 2.5 days. Those were $5,000. And that's what a lot of people are charging for this all over the world. So I think we're doing this the most effective, most lucrative, most doctor-friendly, patient-friendly way possible. Patients walk out, they're not in pain. They don't need narcotics for a couple of weeks. They're happy. They start getting better. As they get off the table, they feel better.
And there's no limitations. There's like, okay, you don't have to lay in bed for 2 or 3 days. When you did me, you went out to eat, and I acted like, all right, what are we going to do? We're going to go play hockey or soccer, or what are we going to do?
There's no physical therapy. There's no downtime. There's no limit of activities. There's no limited mobility after a surgical procedure. There's no scar tissue. There's no fascial adhesions. It's win-win.
And now we don't want to talk about this at this seminar, but there are penis injectile techniques. You're supposed to grow 1/2 inch and get a lot better function. Maybe Dr. Harris can show you that. But there's also female for bladder incontinence and other problems that are really help. Dr. Moore is going to be there assisting and helping us out with the technique in Arizona, and she specializes. Dr. Marc is one smart cookie. He thought she was in her 20s, and she's 42. She does her own face, and she has no wrinkles whatsoever at 42. She's proud to tell her age because you can't tell it looking at her. But when you walk in her office, there's a bulletin that's about 6 foot high and 2 feet across. The one on one side is about the male injections that they get better, and the other is on the female injections. And usually if one of the spouses has one, they want the other spouse to have it too, to be able to keep up with their new and improved ability. So there's the limitations here are only your imagination. What can you do to help the body function better? And that's what we're into here. Pinning this together. Somebody said, why now? Why are you talking about this? You've always talked about the 6 steps to wellness. This really fits into it. It's just much more aggressive. Now we're able to get nutrition precursors and stem cell activators at a massive amount, where before nutrition, it's like a penny's worth. Now we're getting $1,000 worth of information to those tissues because it's umbilical cord nutrition. And I'm going to remind you, 2 weeks from tonight, we're going to have a PhD on here who's done all the research and 18 pages of bibliography of the things he's done, proving that this works and what really does and how it works. So be sure and put that on your agenda. Now, if Dr. Marc wasn't so modest, his big biography would probably be about 50 pages long. How many publications have you written, Doc?
Well, 1,500.
You see what I'm saying? And he's so humble, nobody really realized what he was holding out on us. No longer are we doing that. We're ready to go forward. We have a seminar scheduled, as I said, next month. We have one already on the docket for the middle of September. We're looking for a place either in the California area or Seattle, Portland. So if any of you doctors out there would like to have us come and do this in your office, and you could seat, say, 20 to 30 people in there. Now, you're actually going to do injections and IVs, etc., pushes at these seminars. Is that correct?
Absolutely. This is going to be hands-on. When you walk out of this seminar, you will know how to do this.
And you can get these done on yourself, only at the cost of the seminar. So it's a lot cheaper to come to the seminar than go somewhere and have it done. Right now we have 11 people that are going to have some type of therapy in the Phoenix seminar. Well, we're rapidly running out of time, Doc. Did anybody else ever get enough nerve to send you a question there?
I guess we did a pretty good job. There's no questions.
Well, that sounds good. Well, we're going to have Dr. Harris back on not much over a month from now. Watch for the seminars coming up. We have puzzle pieces, as he mentioned. I've done 2 on stem cells or biological allografts just in the last 30 days, and we have others coming right behind it. So I'm going to say good night for me. Dr. Harris, what are you saying?
I'm going to say goodnight also. Thank you so much for being with me tonight. I hope you found it useful, and I hope to see you in Phoenix in a couple of weeks. And if we have no further questions, thank you for spending your time with me this evening.
Be sure and give Mason a call at 480-964-5198, or just go to brimhall.com and information is there. Dr. Harris, thank you so much. The rest of you, thanks for being here. We look forward to seeing you soon.
Thank you so much. Good night.